Assalamualaikum. Hello, good day everyone. My name is Nurul Habibah Binti Hassan, and today our group, consisting of 6 members, will discuss the importance of mental health awareness, reducing stigma and promoting well-being in society. But first, let me start with a question. How many of you think mental health is just as important as physical health? It's crucial that we talk about this because mental health issues are becoming more prevalent. Did you know that in 2023, 4.6% of Malaysians aged 15 and above suffer from depression, according to the National Health and Mobility Survey, NHMS. In fact, the number of people experiencing depression doubled from 2019 to 2023, and almost half of them had thought about harming themselves or committing suicide. Here's something even more alarming. Malaysia records an average of 1,000 suicides annually, with a significant rise during the COVID-19 pandemic. These numbers are a wake-up call that change is desperately needed. Why is mental health awareness so important? First, understanding and addressing challenges, mental health awareness help us better understand and address these pressing issues. Second, reducing stigma. Together, we can break the cycle of shame and judgment around mental health. Let's start by normalizing conversations about mental health. How many of you have ever felt uncomfortable talking about your struggles? Well, this is common because mental health has been a taboo topic for years. Initiatives like Let's Talk by the Ministry of Health, launched in 2019, aim to promote safe space for dialogue and raise awareness. The more we talk, the more we break barriers, creating a supportive environment where no one feels alone in their struggles. Another crucial step is improving access to mental health care. Currently, over 17% of Malaysians with mental health issues don't receive treatment due to barriers like cost or lack of awareness. Affordability and accessibility are key to ensuring that mental health care reach everyone, including those in rural areas. By expanding access to services, we could reduce the burden of untreated mental health conditions and save countless of lives. Imagine a future where mental health care is not privilege but a basic right, available to all regardless of their socio-economic background. Let's also focus on recognizing the warning signs in those around us. Look for behavior like withdrawal, expressing hopelessness, or sudden change in mood or behavior. If you notice this sign in a friend, do not hesitate to ask, "Are you okay?" Sometimes that simple act of reaching out can make a world of difference by showing that someone cares and is willing to listen. Now, Jaga, what do you think? Do you feel mental health has an impact on our relationship? I would love to hear your take on this. Thank you.
Hi, Abibah. Thank you very much for your words. Your points are really awesome. Suicide cases keep increasing mainly because of mental health problems. People with stable mental health won't ever choose suicide as an option of escapism. They will only opt to live their best life. Let me elaborate my points now as to how mental health can impact relationships. But first of all, let me introduce myself. My name is Jagatheswary Satiya, matrix number JP11290. The connection between relationships and mental health is undeniable. When your mental health is in good shape, you can devote time and energy to ensuring you have healthy relationships. You can focus on spending time with loved ones, nourish your partnership, and avoid toxic relationships, all at which result in a better quality of life. If you have a mental health condition, it can impact all areas of your life, including your relationships. From isolating yourself from your social networks to making one's positive relationships feel more challenging. Mental illnesses have a way of harming the good things in your life. Different types of relationships may be impacted by your poor mental health. 3 ways mental health affects relationships. Now that you know relationships may be impacted by poor mental health, it may help to know the nitty-gritty of how mental health can hurt your bonds. You may spend less time together. Major depression can make you want to spend lots of time alone. Certain anxiety disorders like social anxiety disorder may cause you to avoid social relationships or settings. The result, you may avoid hanging out with loved ones. But here's the problem. To have a healthy bond with someone, you have to spend time together. Pessimistic feelings may develop. As mentioned above, certain mental health difficulties can make you feel down or pessimistic. You may have a hard time looking for the bright side or meeting the worst of other people. These mental health symptoms can play out in a negative way when it comes to your relationships. If your mom does something you don't love, you may be tempted to think the worst of her rather than giving her a pass. Then because you're mad, you may avoid spending time with her. Or maybe you're dating and meet someone you think you may like. Your brain may start to spiral with the worst case scenarios, making you want to cut things off before they even get started. Your loved ones may walk on eggshells around you. Your behavior isn't the only thing that may change. If you are exhibiting mental health symptoms, remember your friends and family aren't mental health professionals, and they may not know how to react to your mental health symptoms. A partner may feel confused about your symptoms. They may also be hurt or be sad by your mental health difficulties. The same could apply to family members or friends. The result of all this is that they may avoid you or stop sharing while they really think out of fear of upsetting or hurting you. The problem is if people aren't truthful or fully themselves in relationships, it can hurt that bond. That's all from me. And next, Athirah, please tell us your opinion on how to reduce the stigma of mental health. Thank you.
Thank you, Jaga. Hi, my name is Athirah. After hearing those opinions, I agree with the points that Jaga and Habibah have presented. Near here, we can see that the importance of mental health awareness is because it will have a bad impact on an individual who experience it if no action is taken or proper help is given. Today, mental health issues are becoming increasingly prevalent, yet the stigma surrounding them remains a significant barrier to seeking help and receiving proper treatment. Stigma is a negative stereotype or prejudice toward a certain group of people. To reduce the stigma, we must take a multifaceted approach that addresses the root causes and educate the public on the importance of mental health. Now, I would like to share some methods or ways to reduce the stigma in society. One of the most effective ways is through education and awareness campaign. By increasing public knowledge about mental health conditions, we can help dispel myths and misconceptions that contribute to negative attitudes toward those who are affected. The campaign should focus on providing accurate information about the causes of mental health issues, the various treatment options available, and the fact that mental illness is a medical condition that should be treated with the same level of compassion and understanding as any other illness. Additionally, it is important to promote open dialogue and discussion about mental health to create a safe space for individuals to share their experience and seek support. By encouraging conversations about mental health in schools, workplace, and communities, we can help break down the walls of silence and shame that often surround this issue. This can help individuals feel more comfortable seeking help and support when needed without fear of judgment or discrimination. Another key aspect of reducing stigma for mental health issues is challenging stereotype and discrimination in media and popular culture. Portrayals of mental illness in movies, television shows, and other forms of media often perpetuate harmful stereotypes that further stigmatize those with mental health conditions. By promoting accurate and compassionate portrayals of mental illness, we can help change public perception and attitudes toward those who are struggling. In conclusion, reducing stigma for mental health issue requires a multifaceted approach that address education, awareness, open dialogue, and challenging stereotypes. By working together to create a more understanding and supportive environment for those with mental health conditions, we can help ensure that all individuals receive the care and support they need to lead healthy and fulfilling life. That's all from me. Aqilah, can you continue with the stigma? Thank you.
Thank you, Athirah. Thank you, Miss Athirah, for your opinion, and I totally agree with that. Nowadays, we can see a lot of education and awareness campaign, especially in social media. As for me, I like to open dialogue and discussion about mental health and with someone I trust. This is the way we can share what we feel and think positively about it. Now, let me introduce myself. My name is Nurul Binti Fauzi. I would like to share my point about reducing stigma in mental health. Just continue what Athirah said. Most of people will feel fear of being labeled with mental illness. This will make him or her reluctant to get a treatment. Actually, when we get treatment with any therapist or psychologist, we can get help and idea how to solve the problem. It can reduce out stress and provide relief by identifying what's wrong and reducing symptoms that interfere with our work and personal life. Next is before we say something, we need to choose the word carefully. What we say and how we say it matters. Making small changes can give big positive impact. For example, we always heard crazy in our casual conversation. Actually, the word itself might make someone experiencing mental illness feel embarrassed or reluctant to seek help. So instead of saying work is crazy right now, or work is crazy busy right now, let's say like work is very busy right now, better. Sometimes we need to avoid mental illness diagnosis as casual descriptors because it stigmatizes actual mental illness. For example, instead of saying, he is so OCD about the project, now we can say, he is focused on the project's details. Last but not least from me, always be in positive circle. Choose who we can be our friend. Don't let any negativity thought affect us. Sharing the facts and experience can respond to misperception or negative comments. Now, I would like to invite my next team, Anis, to share about encourage self-care and personal growth. Thank you.
Yes, Aqilah, I totally agree with you. But before that, hello everyone. My name is Anis. I think the most important thing, as Aqilah said, that is actually seeing therapists or psychologists because only them know to help you with your case because they know how to handle it in a proper way. And today I would like to share a bit of my way to encourage self-care and also personal growth. Okay, the first one is try to set boundaries and say whenever needed. So you don't get overwhelmed and just a few minutes of deep breathing or meditation really helps. Second, you need a quality sleep and stay active. It doesn't have to be a full workout, just a simple one that you can do straight away. I've tried myself by starting eating more fruits, vegetables, and drinking more water throughout the day. Be more kind to yourself, even though when things are messed up or doesn't go your way. I think it's important to be your own biggest supporter. If I make mistake, I try to learn from it instead of just beating myself up. When I accomplish a little part of it, I celebrate, even if it's just a small win. It feels good and keep me motivated. Speaking of motivation, make time for hobbies and activities as well that make us feel happy. Basically, anything that can make you feel happy, like reading or anything you like to do. And also, you can try to spend more time with your loved ones, your friends, or family, because socializing helps us to keep connected and remind that we are not alone in this self-care journey. If things feel overwhelming, talk to a friend or even a professional just to get things off your mind. The most important thing we can do for self-care and personal growth is a mix of being kind to yourself, taking time for what is matters, staying consistent with it. It's not about being perfect, it's about you trying your best and growing bit by bit. What do you think of my point, Intan?
I agree, Anis. Self-care and personal growth can reduce stress and anxiety, increase resilience, and improve self-esteem. Improve emotional regulation lead to healthier relationships and reduce conflicts. Individual prioritizing self-care and personal growth tends to have a good relationship with others. This person always be mindful, has self-awareness, most aware of the emotions, develop good coping mechanism, and build stronger, more fulfilling relationships. Before sharing my opinion, let me introduce myself. My name is Intan Syazana Binti Hassha'ari. I believe promoting healthy lifestyle is the key to promoting well-being in society. Firstly, physical activity plays a big role in maintaining good mental health and release endorphins, the natural mood booster that reduce depression, anxiety, and stress. A society that prioritizes regular physical activities will likely have a more positive and resilient population. Secondly, a balanced diet is essential for mental health. Poor nutrition can lead to mood swings, fatigue, and difficulty concentrating. Excessive consumption of sugary foods and processed foods can disrupt blood sugar levels, leading to the mood fluctuations and potentially contributing to chronic inflammation and mental health issues. Sugary foods provide a temporary dopamine boost, and they can ultimately lead to dopamine dysregulation and contribute to mood disorder. I believe we know the situation of our society today who love sugary foods such as desserts. Furthermore, maintaining strong social connection with family and friends also help to promoting well-being within society. Engaging in activities like spending time with loved ones, joining social groups, or volunteering can significantly reduce feelings of loneliness and isolation. Strong social bonds provide invaluable emotional support during challenging times. They foster empathy and compassion, creating a more supportive and understanding environment for everyone. Actively cultivating social connections, we can contribute to a more mentally healthy and fulfilling society for all. To conclude, educating our society about mental health awareness is crucial. It reduces suicide rates by breaking stigma and encouraging help seeking. It fosters stronger relationships, promote understanding, and reducing isolation. Awareness campaign create a more accepting environment for those with mental illness, encouraging help seeking, empower individuals to get professional support. Prioritizing self-care, personal growth, and healthy lifestyle improves overall well-being within society. Before we wrap up, I want to thank to all of you for your contribution to our discussion. Thank you.